drug strength will come automatically, right? This is a CDSS response, and the same thing will come inside the prescription help prescription section also. The CDSS suggestion, here you can see the same medicine is reflecting over here, right? And if there is any notes comes up, that doctor notes is also come over here. In this case, there is no notes since this is a blank. So I'll go through with the medicine, whatever medicine
Dr.
respond
Shirish,
when serious.
sorry to interrupt. I
Yep.
think hope we're recording this session, so that hope that's fine as well for everyone.
Okay, I think. Okay.
Yeah.
Yeah. And I'm
Amadeep, we are recording the session, right?
Yes, I've started.
Perfect. Thank you. So sorry, Dr. Shirish. Back to you.
Yeah. Thanks. So doctor has selected the metformin having drug, and it is coming directly in the prescription pad. Then he'll select a frequency, the dose required, and the days, and they can simply save. Okay, and they can finalize the appointment and print the prescription.
Shirish, can I add something?
Yeah.
So just for the entire team to give a background, the kind of discussions we had. So definitely this is one case scenario when the patient was not aware about whether he or she has hypertension. And we gave a scenario where Shirish added the fasting blood sugar level. But we can check multiple scenarios, and if there is any suggestion or if someone is thinking about some random values as well, it's perfectly fine, because what we have done before coming to this meeting, we created around 14, 15 different scenarios with different combinations, like patient knows about hypertension diabetes, doesn't know about hypertension diabetes, patient is with asthma or heart disease, and patient is taking some medication, and we got the correct recommendation. So that was one part of discussion that we had before this demo. And then also, if we scroll down, Shirish, if you scroll down, we
Yeah.
also work on the flow, how the information should be presented to the doctor. So if we click on the heart sign, definitely we see all the recommendation in one pop-up screen. And doctor, they can see it from here, they can make a decision here. In case if they don't see it, or if they want to just see and close it, they don't want to take any action, just close the screen. Then we also discuss with the plus 91 team what should be the flow. So the diagnosis should come first. Then there should be some summary and remarks. Like in this particular case, there are no remarks. Then there should be treatment plan, and after the prescription part. So this flow also discussed, and accordingly the team has implemented this flow. We can just to show you one more scenario, Shirish. Like same patient, not aware about whether he or she has hypertension diabetes in the
Yeah.
initial.
Yeah. So I have already created a patient, and I think we can go for the initial assessment. Okay.
So maybe Shirish, just to add a bit, maybe you add asthma as well in this particular case. Yeah.
Okay. Any other field I have to select, Dr. Dev?
No, maybe we're just saying the patient is coming to the hospital not aware about
Yeah.
status. So just add 98 or 100. Yeah, it's fine. Maybe add the random blood sugar also. We can show the. So this patient is not aware whether he or she has diabetes, and we are adding the random blood sugar as 240. Yeah, that's perfectly fine.
Yeah. Can I go ahead?
Yeah, please. So in the previous scenario, we found that the patient has diabetes based on the fasting blood sugar. In this particular scenario, we came to know that the patient has diabetes based on random blood sugar value. And random blood sugar value is the most common taken blood sugar value when the patients they are visiting the OPD settings. From that perspective, also the CDSS is going to give the recommendation to the doctor, and they're based on what we are taking and what is the reading. Now, like if you remember the last scenario, I think there we were recommending the metformin 1000 milligram. In this particular case, we're recommending metformin 500 milligram. So the dosage, the drug will change based on the medical history and clinical values of the patient. Scroll down, yeah. So now we can discuss the hypertension scenario. In this particular scenario, if you see, we got the note as well because the patient has the history of asthma and the asthma beta blockers are contraindicated. The drug that we're recommending is calcium channel blocker. Yeah. So there are two classes of drugs that are being prescribed: calcium channel blocker and ACE inhibitor. And we are giving the text because the blood pressure is on a very high side. When the blood pressure is above certain range, it has been recommended that we need to start with two medication instead of one medication. So that's why there are two different classes of drugs being recommended here. And then also as part of our discussion, we also inform the team that within one class, ideally the doctor should be able to prescribe only one type of generic drug. So all those things have been taken care by the plus 91 team. Yeah.
Yeah, and if doctor want to see everything on the same screen, that is also implemented. So let's say in this case, doctor notes and remark, you can see the diabetic notes was not there and hypertension notes was there. So this is coming on the same screen. You can simply add that. I mean, doctor can simply add that note. Then if you can go for the treatment plan, so these are the treatment plan recommended that you can doctor can simply select, or if they want to not select, they can keep this as blank. Inside the prescription, whatever we are getting on the inside heart icon, that similar medicine you can see over here. You can simply select that from here also, so it will directly getting added in the prescription pad. For the follow-up also we're directly taking from the CDSS. So follow-up date is also pre-populating. So here system is saving a lot of times of doctor by putting the values and all.
If we have some more time, probably we can show one more scenario. Maybe just put hypertension as yes, Shirish.
Yeah.
Okay. Select hypertension drug as enalapril. Yeah, or maybe enalapril.
Yeah.
Or not amlodipine. Or maybe
uh,
you take first drug on the E, just type E. Yeah.
this one.
Even lisinopril is fine. Yeah, this is fine. Select frequency as 1. Yeah. And scroll down. So asthma is already yes. Now make the blood pressure as 160, 102. Yeah, 100 is also fine. Yeah. So we are showing one scenario where the patient is already taking a drug and we are going to submit these new details. Click on the heart icon. Yeah. So now if you see in the hypertension management plan, we are saying hypertension stage 2 and then we are adding the drug calcium channel blocker. So in this particular scenario, the patient was already taking ACE inhibitor and now we have added the calcium channel blocker. So both the drugs are there. Just close it now. And beta blockers are contraindicated. I will explain why I'm showing this scenario. Now in the drug, instead of hypertension drug lisinopril, select, yeah, here, type A, T, T for Tata. Yes, select atenolol. Yeah. So atenolol is a beta blocker. Patient comes to the clinic, patient is asthmatic, and somehow the patient is taking beta blocker. Now click on the submit button. Since the beta blocker was contraindicated, atenolol has been removed from the prescription part. So even if the patient is on the wrong medication, CDSS is not proceeding with that wrong medication, and it is telling the doctor or giving a hint the doctor that okay, beta blocker is contraindicated, and it has taken out that drug from the drug prescription part. So this is the another functionality I wanted to show. But any questions, we are happy to discuss more. Yeah, you can close it, Shirish, yeah, from my side.
Okay, all right. So I think one last scenario we'll go through with patient is already having a diabetic and hypertension, right? And we'll put that medicine and show them. So for diabetic, I'll select yes, and let's say I'll select metformin 500. Yeah, so in this case, you can see the dose is increased by 500 mg. So again, metformin, and we'll recommend 1000 mg. So doctor can simply select that.
Just close it. So maybe we can give one more scenario. Just close
Okay.
it. So the patient is taking metformin as of now, for example. Make it metformin 2000 milligram
Okay.
and just submit it. So now if you see the patient was taking a higher strength of metformin, we have added another class of the drug. So it's a sulfonylurea, different class of drug as compared to the metformin. Maybe we can go to one level up. Just close it. Add another drug of diabetes. Keep it metformin 2000. Add another drug of diabetes. Add glimepiride of any first drug you can select. GLIM. Yeah. Make it the full strength once. Add another drug.
Oh, sorry. One more.
Yeah. Just type P. P for
P.
parrot. P for parrot. Yeah. The fourth drug, pioglitazone. Go for
Again.
maximum strength. Yeah.
Yeah.
Submit it. So now you see we are giving two options to the doctor. The patient is already taking three different class of drugs, and still the blood sugar values are not under control. So one option is to add another class of drug, which is alpha glucosidase inhibitor. Our other option that we're showing to the doctor is, if we click on the option 2, is to start with the insulin. And if you see here in the option 1, can we click on the option 1? We have TZD as the third option. It is a pioglitazone. And then we have added the fourth drug. But in the option 2, if you click on the option 2, TZD is not there because when you start with the insulin, that particular drug is contraindicated or it's not advisable. So that's how, like, even if the patient is on some sort of medication which is not good as per the medical history or is not good because we're going to start the new medication. So different kind of combinations and scenarios will be taken care by CDSS. Yeah, nothing. I think we've explained a lot of scenarios, but
Okay, I think we have covered all the general and bit complex scenario. If anyone have any question, feel free and ask.
So, Dr. Dev and Shirish, I think the UI has come out to be pretty well, pretty nice. I mean, it's much more convenient than what we saw earlier. My just a small query that I had was regarding are we able to include the investigation part in the prescription somehow, or they are showing in the notes and not can be cannot be copied into the prescription?
The instruction part you are saying, right?
Yes, I think investigate any sort of investigations if they are suggested by the physician, or the CDSS. I think suggested investigation in the CDSS are part of the note section. But is there any option to add that into prescription?
No, currently we have not added that directly in the prescription. But if you go to the prescription, no, doctor can add the instruction against drug, whatever drug he has selected. He can put instruction over here.
I got your point, Dr. Shobhit. What we can do, Shirish, the notes that we are getting now, probably if a doctor wants to add that note in the prescription part,
Okay.
they click on plus button like the way you have given the plus functionality everywhere, and it becomes part of instruction. So, for example, this here, although this is about drugs, but in few scenarios they are also uh, advise about getting certain tests done, like serum creatinine and some other test. So from that perspective, it will be helpful for the doctor to have that note within the prescription. So here you have given the plus tab. Now, if you click on plus tab, probably we can add this note into the uh, prescription also, if you build that functionality. Is this what Dr. Shobhi you were talking about? Am I right?
Yes, yes, exactly. This is what I was talking about. I think for the time being it's fine because I mean the doctor can type it out, but if we are providing convenience, then this will add onto that convenience part. So yeah, that can be done later on, and we can sort of as you have already prepared 13, 14 scenarios now. Just we can also include one more scenario where investigations would be advised in the note section,
Sure.
and that can be tested in further integrations, whether or not those functionalities are there.
Uh, in fact, after my discussion with you, what we have done, we we haven't informed the Plus 91 team as of now, but maybe we can have a call separately. So, Shirish, currently we are talking about the medication part. Like we are, CDSS is giving the recommendation about the medication part, but now APIs for the lifestyle advice are also available. So what it means, because the patient with chronic conditions, they require advice on the lifestyle changes as well.
Okay.
So we'll discuss it how probably you can bring that on the screen if I think that is also advisable. So lifestyle advice means like how to take the medication, what kind of diet usually the patient with diabetes or hypertension should take, some instruction, the exercise and importance of taking medication on time. So those kind of instructions will come. And if we get more information about the patient, for example, if the patient is a smoker or consume alcohol, accordingly some further advice will can be added. But that as a like obviously as a digital health company, if you also like again want to capture all those things, in a long run it is also good from the EHR perspective also, and then it will also help CDSS in giving the personalized advice to the patient.
No, no problem, Dr. Dev. So we'll discuss that then and we'll get this added.
Yeah,
I think that will be better to have. Yeah.
but I think from the pharmacological treatment point of view, I think we have covered um, maximum possible scenarios for hypertension and diabetes. Dr. Amardeep, any questions from your side or any suggestion?
If I'm audible.
Yeah, we can hear you.
Yeah. So, Dr. One last thing that whatever you suggested at the end is needed to be there in the system right now, or the later on can be added, or it is required at the highest priority level.
Sorry, I did not get your question. You're saying you're talking about the lifestyle advice.
Whatever the additional point you are suggesting, it need to be incorporated in the system right now, or the later on it can be adopted.
So I think it can be adopted later on as well. And maybe we'll discuss with the Plus 91 team offline. And if it's not going to take, like, because now it's a very simple API, and probably if it's not going to require much time, we can build within a day or two. I don't think it's that complicated as of now.
Okay.
But that can be added later on as well.
That maybe the discussion would be required with the Plus 91 team.
Yeah.
Shirish, any point from your end on this the new requirement?
No. Dr. Amardeep will discuss that offline then, and I think we are good to add that information because that will be better to have that in the system.
So once we get the API, it would not take more than 1 or 2 days to deploy it.
Dave, Narendra here. Just I've gone through the demo and looks good and comprehensive. Just wanted to know, have you documented all these scenarios and test cases? See, with plus 91, you've done all this, but going forward, we'll have multiple integrators coming into play, and so we would like to know to what extent they have done it. So all these scenarios and what they have to do and what will be the expected outcome. Uh, will you be able to provide it as a test case document so that in our normal EVDM integration, we actually see to what extent they have done. So when you're looking at this, CDSS tool being integrated by all the HMIs, we'd like to know whether they have done it completely or just, not done it fully. So the kind of, usability which the doctor will have, we would like to have it as a documented thing. So I just hope you create all these scenarios and test cases and see that it is,
Yes, sir. Yes, sir. We have exactly done the same thing. We have created an Excel file with the
Okay.
15 scenarios, with the parameters and the expected outcome from the CDSS recommendation.
Mhm.
And also based on our now, because the discussion with Plus 91 also helped us in improving understanding what all other informations we need to tell to the integrators. So we are documenting all our learning also. Now the new version of the documentation will be having much more details. Because the technical details were already there, but in terms of what need to display, what should be the flow, so all those things we have added in our documentation as well. We are taking notes from each and every meeting that we are having with the Plus 91 team, and we are improving our documentation. And case scenarios also, we have created around 15 case scenarios, and probably if required, we'll add more scenarios as well.
Yeah, so I mean, as you rightly said, see, some feedback would have come from Plus 91, how it can be done in a better way. So, because we'll not have this luxury going forward when the other integrators come into play. So,
Yes, sir.
any other thing which you want to add or think? And no, anyone is there from Plus 91 or not? So, have you tried it with any actual user doctors who would be using this system?
No, not now. So we are at final stage to concluding this integration. So I think we'll get this testing closed by next end of the week, and then I think we can give this to doctors.
Maybe you can just see, I don't know, because if you go give it slightly later, at least have a run down a demo with at least one doctor, with a
Okay.
practice doctor. So if they give you some feedback, it'll be much faster, much easier. Because once you give it to a larger group, everyone will come up with something different.
Right. So what we can do is then I think from next week onward we can provide this to the small doctors and we can collect their feedbacks.
Have it with a close group and whoever is, who will give you a better. Whoever gives it, they will spend some time on it. So just have a close interaction. That's what my suggestion would be.
Yeah. Okay. Thanks, sir.
Totally agree, sir. Yeah.
I think that's
Dr.
it from
Dev,
my side. Anything else? Anyone else?
yeah. Dr. Dev, can we have those scenarios documented which you are keeping with you? Can we have those scenarios with us if you're able to
Sure.
share with us?
Sure, we'll share it with you. And also, Dr. Amadip, you want to discuss it now or maybe after this meeting about that webinar on
After
Monday?
this meeting, we can offline, we can discuss. Once you share
Okay.
with me, I'll go through it and anytime offline, I'll connect with you and we will discuss over it.
Okay.
In the meanwhile, if you can share with me, that would be better to understand before discussing with you.
You're talking about the scenarios which we are.
Scenario, yes, for based on the diabetes and the hypertension. So we have the series showcase all the scenarios, but better to keep it on a documented. If you can share with me, I'll go through it and then we'll have a discussion offline over it.
Okay. And okay. Anyways, like I will call you after this meeting
No
as well.
problem. Yes. Shirish, anything from your side?
No, I'm good.
Sanchit, do you have any point over it?
Yeah. Just
Sure.
one thing here. Dr. Shirish, maybe I think I'll request Narendra sir and Shobit to add here as well. Once you've done the initial assessment with the control group or the very small group of doctors, maybe if we can just share a plan with regards to the geography and the number of doctors or the hospitals you're planning to implement this
Okay.
particular CDSS. If that plan can be shared with us in advance, that will also be helpful.
Sure. We
Narendra
will
sir
figure
and
a plan
Shobit,
and share
I'll
it.
request you to add.
Oh, same thing,
That's it from
Sanchit. I
my
mean,
side.
now that we are done with the integration and Plus 91 is the first ready-to-use product with the CDSS, I mean, it would be great to see
Yeah.
what is the actual response from field, and I'm sure there would be multiple suggestions that we can sort of include. So overall, for the whole project as well, there would be great learnings to come from this pilot once it start getting used in field. So let's hope
Yeah.
we are able to sort of go to both government hospitals and private hospitals, because approach at both places would be much different. Let's see what happens and what comes out.
Okay, sir. Yeah.
Okay. Can we conclude this call?
Sure.
Shobit, anything from your end?
Oh, I'm done. Yeah,
Okay.
you can close.
Thank you so much. Thanks, Dr. Dev. Thanks, Shirish,
Thank you.
for joining
Thank
this
you,
call.
everyone.
Thank you so much. Thanks. Thanks, everybody. Thanks, Thomas.
Thank you.